About 19 years ago, just about this time of year, the new Labour government's, one of their earliest first actions was to introduce into the Westminster legislature the Human Rights Act. It was entitled Bringing Human Rights Home, because up until then, if you had concern about your human rights, you had to take your case to Europe, and I'm not going to go there today. It was about bringing human rights home. In September last year, a big stone's throw across the Clyde in Govan, in the Pearce Institute, the First Minister, in challenging an attempt to revise the Human Rights Act, said that in Scotland, our intention was to ensure that human rights and the Human Rights Act was a floor, not a ceiling to which we aspire and cannot go beyond. And she called upon civic society and the public sphere in Scotland to work in a way to ensure that human rights were embedded in everything we did. So human rights came home and is coming home. And what we are here at this point to celebrate is Scottish CaRE's work with a dedicated group of individuals from Constance Care, from Loreto, and from Baillieston Home Care, who have given off their time to work with Carolyn Miller to devise what you have on your seat, which is the Convention on the Rights of Adults and Older People Receiving Care at Home or Housing Support. Believe you me, we tried to get a snappy title. The group of people who I'm not going to embarrass by asking them to stand up, but who are sitting essentially in front of me, and there are 20 representatives of a group which numbered well over 40, in their own words articulated what human rights meant for them. They brought human rights home. And if you look at the document and the convention, you can see what was important. Quality care, choice, dignity, having a voice, being heard, feeling safe, being valued. And I'd invite you to look at the document, read the document, and think about what that means for your work and your service. And on our website, there's an opportunity for organizations and for individuals to sign up and show your commitment to embedding human rights in care at home and housing support. But I want to go back and use that analogy about bringing human rights home. Because to a certain extent, what we've done is to bring human rights home and kept it at the doorstep. It's not moved into every room in our house of care. We've kept it at the doorstep. So today, one of the other activities we're doing is to call our partners in government, local authorities, and other stakeholders to work with us to develop a human rights model for commissioning social care in Scotland. Because it cannot be right that we continue to spend less per capita proportionately on older people's care and support in Scotland than we did 10 or 15 years ago. It cannot be right that individuals who are older when they get to 65, apparently something magic happens, I'm looking forward to it, suddenly are treated in a different way, we would say in an age discriminatory way, in the way in which finance is allocated to their care and support. With the Cabinet Secretary, we applaud and are delighted about the living wage and the allocation of 125 million to enable that to be paid from the 1st of October. But it cannot be right that at least one local authority, and I could name a number of others, consider that allocating £13.95 to providers is adequate for paying the living wage to our dedicated workforce. Because at $8.25 with add-ons, that gets to $10.55. Put a bit more into that, and you have no room to innovate, no room to work with people to get for them the service and support they deserve. That cannot be right. That is not a human rights way of allocating resources. And that's what we want. We don't want to leave human rights as the concern of individuals. Of course, fundamentally, and the new care standards will predominantly emphasize how human rights have to be articulated as the way in which we offer care and support, the way in which we work with individuals. But you cannot have a human rights-based approach to care without a human rights-based approach to commissioning and a human rights-based approach to budgeting. One without the other is playing politics, it's rhetoric, it's not reality. We are at a point of shaping a reformed social care system in Scotland. So let's be adventurous. Let's really embed human rights. Why is it that we have care and support in the health service free at the point of access and delivery? Why can't we, with devolved new powers in Scotland, not least in terms of taxation and welfare, create a social care system which is free at the point of access and delivery? Let's create equality for all our citizens, because proportionately, those over 65 dominate in terms of the use of social care. So human rights, if they are to remain meaningful, have to get beyond the front door. This statement, this convention, is a brilliant piece of work, a dedicated piece of work of those in front of me. It's not a document of dreams. It's a call and a challenge to work together to ensure that the whole system of care embeds human rights at its heart. So when you're making a decision about what proportion of your budget you spend on the most vulnerable in our society, you're doing so based on human rights. When you're making a decision about how you allocate restricted funds at local authority and at IJB level, you're doing so through the prism of human rights. When you're going into somebody's home to increasingly deliver services at the end of life and in palliative conditions, you're doing so from the perspective of human rights. And with the third dementia strategy potentially round the corner, which will emphasize advanced and later stage dementia, when we are increasingly working as home care staff and organizations in challenging, complex, multidisciplinary teams, we're doing so from a perspective of human rights. I'm delighted to officially launch this convention this morning. This is the start. It is our floor. We have to aspire to a ceiling which has human rights, not just in words, but in reality. I commend and warmly welcome this launch, and I would like you to express your thanks to those who have taken part in its composition over the last few months. Thank you.